Hey, everybody, and welcome back to episode 20 of the Positivity Xperience podcast. I am your host, Lori. And guys, I am the proud parent of a newly graduated Salisbury University Seagulls Bachelor's Associations in Communications. Proud mom. That's me. So this weekend, that's what we did is we got to actually see my son cross the stage. They did like an abbreviated version. Well, not really. Well, it was an abbreviated version, which honestly, I think like everybody should do that because it was so amazing and it was so time like easy in like 15 minutes. And then we had a gathering here at the house and small gathering, had some people here. It was so nice. And for anybody who's listening who has supported his journey and ours across the board, I just want to thank you and let you know that he walked for you as well. The only thing that I would say really kind of threw off the week a little bit or the weekend celebration was allergies. Oh my gosh. So my son, he almost died when he was in first grade from an asthma attack from allergies, right? And it was so bad. And we were in the hospital for a few days. I stayed in the hospital bedroom with him. And it was pretty similar to not similar, that was wrong, but it was definitely a reminiscent reminder yesterday. Here in the East Coast, I'm in the United States, I'm in the state of Maryland, and we have horrible, horrible allergens, just awful. And there's something called the pollen dump. And that's unfortunately what we were experiencing. So fortunately, my neighbor and friend Deborah had a nebulizer, but he had to do like 6 breathing treatments last night. And he was really on the struggle bus. So it was really, really hard for him to actually enjoy himself as much as he would have liked to with the graduation party. But he's back home and he said he's still a little tight, but he is feeling a little bit better. And I thought, wow, that's an interesting segue to kind of go into what I'm going to talk to you guys about this week. And if you heard in the beginning part of the trailer for this week's episode, this is episode 20, and I'm super excited. But if you heard that sort of warning, I just want to kind of keep in mind that a lot of times if you have anxiety, especially health anxiety and death anxiety, which is thanatophobia, can be a little triggering. I would encourage you to try to listen. I'm not going to be super triggering, but I do want you to be aware of it, right? Because I feel like health anxiety is something that more people struggle with than you actually think. What exactly is health anxiety? Think of it as so it's hypochondriasis, right? So it's like being a hypochondriac, right? Have you ever heard somebody go, you're a hypochondriac because you always think something's wrong with you? It's similar to that, except for it's where you are so petrified that anything that you feel, a headache, a heartbeat, anything that you feel is often triggering for you because you'll go down the rabbit hole of, oh my God, what's going to happen? This is bad. This could be really, really, really bad. And you start thinking worst case scenario to the point where, depending on how debilitating it is for you, you'll avoid going to the doctors. You will go, oh my God, I just don't want to know. Let me explain to you why that will never serve you. You think that you're avoiding the what could happens, right? Like you're like, okay, and in theory, you kind of are. You are avoiding that. However, you are also left in your mind to sort of come up with your own scenario. And then the worst thing that you can do, and so many people do, is you start going down the rabbit hole of Google. Dr. Google. You join Facebook groups, you join Twitter groups, you join all of these little sort of breakout groups of, hey, if you have this, these are your people, which by the way, can be so effective and very, very helpful until it isn't. And what I mean by that is, and it's not like the group's fault. Like it's not like the group is bad and it's setting you up for something horrible. That's not it at all. But it is what you grab onto. So my health anxiety, and believe me, it rears its ugly head on a regular basis, but I'm always trying to use my own tools, right? Because sometimes we can be really good instruction givers, not very good instruction followers. That's just how life kind of works. And so let me explain a little bit about why, I know where my health anxiety came from, and that would be from my mom. So my mom, So she gave birth to me when she was 44 and my dad was 49. Now that's still even a little old now, but it's not like it was back then. Back then in 1971, that was like, I think they even asked her, like, is this something that you really want to continue? Do you want to continue, make this a viable pregnancy? And she chose yes. And and I told you, I've had anxiety all my life. So do I think that, I don't want to say being born to older parents caused issues, because it runs on both sides of the family. But also back then, my mom was a smoker. My dad was a smoker. Again, not blaming that. I'm just giving you some context because they didn't know that that was bad. They weren't like smoking's bad, and none of that was a thing. And when I was about first grade, my mom got pneumonia. Now, mom and dad used to host, they had a little group, like couples and stuff like that, and they would host game night, like poker. They would play for cash, and they would start on a Friday and end on a Sunday, like literally be up all night. Might go take a nap, come back in. I mean, it was like a chronic thing. Well, we had it at our house, we had it in one of the people's house that we went to, and the basement was damp. Well, my mom ended up getting pneumonia. And now keep in mind, she also she's had health anxiety all of her life, which I didn't even really know about, right? Because I wasn't born until like later on. And I told you about her phobias and stuff like that. And that's going to be a part of the conversation, right? And when she got pneumonia, it was like really, things sort of they took a weird turn, right? So she had pneumonia. And this is over 7, 8, 9, 10, 11, 12. Let's say about a 7-year period of time before she passed. 7.5 years. And it went from pneumonia. Then it was, I'm trying to remember, and what has been told to me, because I was also like 6 and 7. And what I remember is she had a heart attack, and then she was in the hospital recovering from that. She ended up having a stroke. She was paralyzed on her left side. She had her spleen removed. She had multiple blood transfusions. She had hairy cell leukemia. She ended up brushing a mole off of the side of her forehead that she couldn't feel, and ended up getting a cancer in that as well. And so overall, she was riddled with cancer across the board. Now, in combination with that was also her severe panic disorder, long before she ever got sick, but severe panic disorder. And every time she would get sick, it was always like, oh my gosh, death. Oh my gosh, death. Oh my God. Like that was the thing. Well, that's all I saw, right? So as a kid, I'm seeing this, and I'm seeing that for her, when she would respond, when she was in anxiety, when she was in anxiety, she would pass out. So if it got too much for her, it didn't matter where she was going to pass out. She was going to pass out, fall out, just how she did. So she was always worried about being sick and death, So this is all I saw. So now you fast forward ahead. And of course, any little thing that came up for me, I was like, oh my God, this is bad. This is really bad. Because that's what I saw. That's like, so a lot of times with health anxiety, there is this trigger as to, is it something that you've seen? Is it something that you're worried about? So for me, I know where mine came from. And mine came from seeing it at home and seeing everybody sort of like make fun of her. The making fun of her was kind of standard back in the 70s and 80s. And I'm not dismissing it, but I'm saying like when that would happen, it wouldn't validate her. And I mean, a lot of times the family was right. Like she was having an anxiety attack. We didn't know that. And they'd just be like, you're fine. Oh my God, you're doing this again. Like it was really bad. So if you're struggling with that health anxiety and being like, I don't want to go do this because of this. I don't want to do this in case this could happen. There is always some kind of a trigger point. Okay. And you could say, yeah, it's because I don't want to leave my family. Fair, but there's a deeper issue to that. You have to figure out where that is. That's where thanatophobia comes into play, death anxiety. So I really believe, and what I've seen in my practice and in my personal struggle bus, is health anxiety, death anxiety, they typically go hand in hand. And this is a hard thing to wrap your head around. And it can be triggering for many people, right? Because I've said this before, I've said this on other social media platforms, is it doesn't matter how rich you are, how famous you are, how amazing you are, all of the things that you do for a profession, you've solved world hunger, it doesn't matter. Your end game is death. I mean, it is. It is. You can't outrun it. You can't out-eat it. You can't out-exercise it. It just can't happen. That is a guarantee, not maybe. This isn't me dropping some kind of scientific knowledge on you. This is facts. And it becomes difficult when you can't wrap your head around it and you're always on the what if train. So when you're always in the what if train, you're not living in the present space. And again, I'm also speaking from full on experience. Okay. Full on experience. And the biggest issue is it's so robbing. Oh my God. It'll rob you of your peace all the time. Because immediately something goes wrong or something feels a little different, or you've heard something about something in the news or whatever, it can become very debilitating. So you have to ask yourself, first of all, what am I really struggling with? Nobody wants to suffer. Nobody wants to get sick. Nobody wants to suffer. And really nobody wants to die. Okay, that's literally what it comes. Nobody wants that to happen. Nobody. And it's the toughest part, bitter pill to swallow. Like, that's this weird game of life. You're born, and the scientifically, they say the first day you're born is the day that you start dying, right? Because you grow older. It's just, that's kind of the overall. I have a lot of scientist friends, and they're super morbid, but that's kind of what they say. Oh, such and such is born, I guess they're going to start dying now. I'm like, okay, wow, you're going on the dark road. But I do understand that concept, which is where that mindfulness comes into play, right? The mindfulness, staying in the present space. You cannot control it. It is about accepting it. So here's some homework for you. Here's some homework. What is it about death and or bad health, anything like that, that you struggle with the most? Okay. And the reason I say that, and this may seem a little weird, but it's factual. When you have death anxiety, it's very often you are also not comfortable typically in where your life is now. Maybe you don't feel accomplished. Maybe you want to accomplish more. Maybe you don't want to be forgotten, which was my big thing. I feel like that's my biggest concern about death in general, is because think of it, right? If I ask you right now, who is your great-great-grandmother on your mom's side? Okay, let's say you've done your genealogy. Most of us have not gone that far back. Let's say you have. It's like, oh, my great-great-grandmother was Elizabeth. What do you know about her? That she lived in Pennsylvania. Okay. But you don't know her, right? And so for me, it's sure, if you're George Washington, if you're Martin Luther King, if you're, somebody who like makes this impact, or a president, whatever, and it's not that people know you, but they do read about you, so you're not really forgotten. For me, I think that's always been it, which, by the way, is a total insecurity. It was always a total insecurity, because I didn't feel seen. I didn't feel heard. I felt abandoned. I felt, just all the way across the board. And so when you have those fears, it goes to something. So I would encourage you to sit down and go, okay, what is my biggest concern? And in combination with that, what is your biggest concern about staying in the present space? Because you can't have control if you're in the present space. There's nothing to control. You just have right the second. Like you just can't control. It's just, you're just here. And it's about, at the end of the day, you can keep trying to prevent things. Yes, you want to eat healthy. I feel like you can definitely encourage those things to give you a more sustainable and hopefully a longer longevity in your life, right? And a healthier all the way across the board. Working out, exercise, eating correctly, drinking your fluids. If you're taking meds, take your medicine. Like whatever the case may be, of course I feel like you can absolutely, hopefully extend that. Okay. But unfortunately, there isn't like a rule. It's not like, okay, if you do this, you're guaranteed this, that, and that's, I think, the screwy part where people struggle the most. So I'll tell you, do not avoid going to the doctors, because you're like, oh my God, I don't want to go. I will tell you this. And I've had surgery on my leg. When I got into a car accident, I had to have my leg, I had to have a debridement, like scrape all of the old gunk out and put my, they did a skin graft, right? So I had to be put out a couple of times. Okay. And it was so funny, not funny, but like, it was so interesting because I didn't really mind too much at the time, because I was 21. I thought about it, but I wasn't as thinky about it as I am the older I get, even though age is not really a thing. I mean, we'd like to think we're all going to live to be 135 years old healthily. And okay, I hear you. Like, let's be realistic here. And I've always had a weird thing about hearing my heartbeat, like on an equipment, right? It's funny because on the Calm app that I use to go to bed, they have, I'm part of their white noise. I do the stories, but like I'm part of their white noise. It's like heartbeat. And I'm like, that's not relaxing for me. If I'm trying to fall asleep, no, that's, oh my God, that's going to keep me awake. Other people are like, oh my God, this is super meditative. And I'm down for it. And I don't know well, I do. I think it's because mom had a heart attack and then she had a stroke. And then I've always struggled with massive heart palpitations on a regular, right? I've been to a cardiologist. I've had this thing, like a heart catheter thing that goes up through your main artery in your thigh when I was, in my groin when I was 19. And they control your heart. They shock your heart. They make it go faster. They make it go slower just to see like if I had a blockage. And they were like, oh, it's stress. Okay. So that's 20, 30, 40, 30 years ago. Right. And so, they're like, okay, this is just kind of what it is. I've had heart monitors. I've had all of those things. And so, yeah, they happen and you feel them and you're like, ooh, that's uncomfortable. Or it's just creepy and scary. So you try to get as much knowledge as you can. And, I always say, make sure you do anything with a gist. Cardiologist, radiologist, anything with a gist. And a chiropractor and anything that you can think of that's going to give you sort of the overall workup, making sure you're getting your blood taken. And you're like, yeah, but oh no, I get scared of the what ifs. Okay, so then if you don't know, you're left to create these scenarios in your head. So it's kind of like the screwy damned if you do, damned if you don't kind of thing. But that is kind of what goes on. And you're trying to avoid it, but it's not really avoiding it. You're just not hearing it. And then a lot of times with health anxieties, you don't believe it, even if somebody says that you're okay. You're like, yeah, well, no, because I read on Google, stop it. Stop reading Google for medical advice. Sure. How can I cope with this? What can I do? Absolutely. Research, down for that life. It can be effective. What is not effective is when you're obsessively on it. And a lot of times too with health anxiety is there could be 100 million people that are like, look, I took this med and it was great. Or I had this situation and it was fine. There could be one person way over in the corner somewhere that's like, ooh, yeah, that was not good for me whatsoever. And you're like, see, what if I'm that person? What if you're not? But what if I am? What if you're not? Well, no. What if you're not? So you're so focused on trying to avoid and trying to worry about it. There are things in which you can absolutely do that's going to help you get through this. If you're having anxiety, which it does create anxiety, and if you have anxiety, it absolutely leads into health anxiety 75% of the time, right? Getting your anxiety under control. And when I say under control, I don't mean not having it. I mean learning to walk with it, working with your traumas. These are things you got to do. You got to be raw. You got to be open and honest. Stay off Google World. Stay off. Like if you can't just go on there and be like, hey, what does this mean? Or, hey, what should I do with this medicine? There's helpful things there, but not if you're going to obsess on it. Okay. And then, like I said, then you're left to have that. So it's walking with your anxiety. Do not keep researching to see, how can I solve this? What does this mean? Why can't I do that? Ooh, I got to avoid doing this. What if this? Stop doing that. Okay. Like I know it sounds way easier said than done, but I need you to understand that you avoiding it or you not wanting to hear about it only feeds the beast of needing to research it and being your own sort of diagnosing yourself, right? Haven't you ever read something? If you're like, oh, if you have blah, blah, blah disease, this is what your symptoms are, blah, 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 blah. Well, if you haven't gone to the doctor for blah, 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 blah disease, you're going to sit there and you're going to be like, oh, I have that. I have this. I have that. See, I probably have this. Stop. It's like you're trying to control a narrative. It's unfortunate. I mean, does it freak me out? Of course. Both my parents passed from cancers. My mom passed when I was 58. And when I was 58, when she was 58, I'm 50. Okay. Sure. Is it something that that it rears its ugly head on me on a regular basis? Pretty much, yes. But I can't let it debilitate me, and it's almost like you're always looking for the negative because that's more comfortable, even though you don't like it. So if you're looking for the negative and then something negative happens, you're like, see, told you. Where if you're looking for the positive, you're like, oh, you almost don't know how to respond to it. So it's understanding that the more that you're feeding the belly of the beast of the research, the worse it's going to be for you. And health anxiety is attributed to other anxieties. So it's going to the doctor, explaining to the doctor what you're struggling with. And, but that's what I said. It's also like, and it'd be interesting to see, like, if you go on the Positivity Xperience podcast page on Facebook, believe me, I don't live on Facebook world, but I do like to have it for like groups. I feel like that in like private pages are kind of really cool over there. But if you go over there and you respond underneath, because this will be posted in there too, just it's easier for people to find it. But like, go in there and drop on there what your biggest fear of death is. Is it, typically I'm going to tell you the ones that I hear a lot. Don't want to leave people. What are my kids going to do when I'm gone? What's my family going to do when I'm gone? What happens after I'm dead? These are all of the things. But now ask why you can't be okay with accepting that is one day, you could be 300 years old. One day, that is your end goal. That is 1000% going to happen. Not me, going to happen. It's happening. Ask yourself, why is that really so hard for you? What is it that you fear? Because often when you're not living in the present moment, not living in the present space, and again, that's a trauma response. That's a control response. Which, by the way, control response is a trauma response. All of those things come into play. And of course, then it's like, well, I don't want to see this person pass away. Like, I don't want to see my loved one pass away, or my husband or my father or my dad, Sure, I nobody does. Okay. But it's if you're chasing the fear of when something happens, it's going to suck for me, or what's going to happen, you're not spending time with them now. And I don't just mean time, I mean energetic time. If you're so worried about what it's going to be like when they're gone, you're not focusing on them here in life. Yeah, but I'm going to be real. Why are we there? You are here with me right here. Stop it. Stop it. And I say that from a person who has experienced it. Health anxiety is my biggest anxiety. It's health, and then it's financial security, both of which I've had traumas in. Financial security, which I don't know if you heard it a couple episodes ago, and it's going to be in my book about how we lived in a van, my dad and I, after my mom passed. And it just becomes this thing that you just don't ever want to feel again. That is a trauma response. And it's understanding when that rears its ugly head, I go, okay, obviously I need to work through this again and realize I'm 50 now. I'm not 13, 14 where I can't control these things. And even then you can't really control them. And that's ultimately what it all boils down to. Mind, safety, and security. I mean, you can control it as best as you can, but you can't fully control it. Same thing with health anxiety, death anxiety. You can do things to make it better for you and encourage it. Can't control it. So it ultimately comes down to that. And it's the fear of releasing that control and those worries in order to stay in the present space, which is an absolute practice, And I always, in the show notes here, I always try to put the website in there. And I do that because there's a lot of free resources. I'm like, cool. But if you ever wanted to get involved with like a paid service, like a paid, something that I do from a paid perspective, that's where you would go. And people are like, okay, I just want to start healing and feeling better. And I want to stay in the present space. That is what you do. And you do not go down Dr. Google. You do not go on groups just to find the negatives. Right? Like if you're going on there and it's encouraging you, rock it out. Like I'm down for that life for sure. But if you're not, you're just creating that loop. Now we are on an anxiety loop. So there's a few things, right? Like as we come close to where we're going to wrap this up, is asking yourself why you struggle so much releasing control. If you're like, well, I just don't want, no, go deeper. Because there's always a deeper to the deeper to the deeper until you get to the bottom of it. And I mean, it sucks, right? Because you're like, okay, well, this is what I'm doing. And then you're like, okay, am I finding my purpose? Okay, wow, calm down. Like you are putting so much pressure on yourself that you're making it 100 times worse for all of the anxieties in which you're struggling with. And that's where, like, I really want you to start working on it. So be interesting over in the Facebook group. If you're hearing this and you're on Facebook, or I would go over to the Positivity Xperience with an X, just like the podcast. And underneath here, let me know what it is that you're struggling with. What is it that you fear the most? What is the hardest part that you're having? Because at the end of the day, you can try to control it all you want. You can worry yourself into oblivion about it. It's not going to change the end goal. It's just not going to happen. Not maybe, not. And it's getting clear in that. And then focusing on living now, right now, in this second. Not 5 minutes from now, right now. Right now. So that's where I'm going to leave you. But I will let you know, like if you want to talk more about it, which really, ultimately, it's an anxiety, whether it be health anxiety, death anxiety, fear of jumping out of a plane. I don't know. Like whatever that is, it's still going to rear down to lack of control and fear of releasing it, really. And then also it's going to go to not staying in the present space. It doesn't really matter what the phobia is. It doesn't really matter what the worry is. Those are the two things that it's always going to come back to. Not being able to control a situation, fully control it. And that and acceptance, I guess there's probably a third, like there's that. And it's staying present. You don't always have to be in prepare mode. Stop trying to prepare. You're preparing so much you're not living. And then you wake up and you're 90 and you're like, how the hell did I get here? My life just went by me, because you're always chasing the preparation. So with that, I will say you guys have a great week. Remember, I do the podcast. I try to put it up every Sunday. I try to put it up every Sunday evening. Sometimes it happens on Monday evening. And I have the YouTube, which I'm actually going to also do just small clips from this and throw it on the YouTube as well, just so you have it. But yeah, I'm here for you. I'm here for it. And just remember, be kind to yourself. Be kind to yourself. Don't beat yourself up, right? This is a process. You didn't get here overnight. You're not just going to snap out of it and heal yourself overnight. That's not a thing. So there is a process to this. It's healing yourself. It's time. It's patience. I understand you're just like, I just want this to stop. Of course you do. We all do. That's the control aspect of it again. And that's where I want you to start learning to release that control, because the releasing control actually gives you control of your life. By releasing control, you are actually in control. By being in control, you're actually being controlled. Those are two things that are so important. If you take nothing else, take that. Be kind to yourself, be kind to one another, and have an amazing week.